Yes, come in. Oh, hello. It has been a long time since I've seen you. How are you? You look well. Yes, you're very overdue for your annual physical exam. The last time I saw you was last summer. Can you believe that? How's life been treating you? I see. Well, we do get very busy. I can appreciate a busy schedule. But how are you feeling in your overall health? Well, that's very good to hear. Oh, well, that sounds amazing. Yes, well, I've just been wrapped up here since I saw you last. Haven't had any time off, but I think I am planning to take some vacation time, maybe start of next year. Maybe go skiing or something. Yes, I will be careful. Anyway, shall we jump into the pre-examination questionnaire? I'll just fly through them and you just tell me if anything has changed or you want to just bring to my attention anything else that I may have missed. Alright? So before we begin, can I get you to confirm your name and your date of birth? Yes? Okay, and do you consent to me carrying out this routine health examination today? Good. Confirmed. Right, and can I double check all the medications that you're taking? You're not taking that one anymore, okay. Just avoid that one. Any other over-the-counter medications you're taking? No. Did I remember correctly that you were taking some just oral, like Gaviscon for your heartburn? You're not taking that anymore, okay. And are you experiencing any pain or symptoms at the moment that you need to bring to my attention? No, patient's in good condition. Let me just bring up your test results here. Just loading, it's very slow today. And the mouse seems to have broken, so I'm using the keyboard to navigate, which takes a little longer. I apologise. Right, your results from your blood test all came back fine, so that's great. I will be requesting another blood test for you this time, of course, but you'll have to just go down the hall to the blood centre there, just as before. Right, no major or minor surgery in the last year. Any visits to the emergency room? No. Any other illnesses this year? Cold, flu? Okay. And has your diet changed since our last visit? No. Consumption of alcohol? Has that kind of remained the same? Yep, that's great. How many units a week would you say? Same, so 1, 2, okay. You still don't smoke? Good. And exercise? All the same. Okay. That's perfect. Right. So if I can ask you to get into a comfortable position, then I'll start the examination, okay? Wonderful. Okay, so are you sitting nice and comfortably? That's good. So first of all, I'm going to have a little listen to your heart. Now, have you experienced any pain or discomfort in your chest in the past 12 months? Alright, that's good. Let's have a little listen then. Okay. Okay. Could you just take a nice deep breath in and out? Good. Deep breath in. Good. And out. Nice. Now breathe in and hold your breath. And exhale. That's very good. Alright. And now I'm going to listen to your lungs. Any respiratory distress over the last 12 months? Any coughing, tightness of the chest, breathing difficulties? Alright, that's good. So breathe in and out. Good. Breathe in. Breathe out. Good. Breathe in and out. Breathe in. Hold. Breathe out. Good. Breathe in. Hold. Breathe out. Good. I'm just going to reach around the back here. Breathe in. Hold. Breathe out. Good. Breathe in. Hold. Breathe out. That's wonderful. Alright. Very good. Excellent. Height, of course, has remained the same. And if I could just ask you to pop on those scales just behind you, they link up to my computer. I'm just going to check your weights, okay? That's good. Yep, and step on. That's perfect. You can step off now. Thank you very much. That would calculate your BMI. Alright. Perfect. So now I need to take your blood pressure. Let me just go and grab the cup. Alright. So, yep, this arm. Okay, let's put that around you there. Is that comfortable? Alright. Okay, here we go then. A little bit tight. Good. Alright. That's very good. Blood pressure is absolutely normal. Just go pop this back. Okay. So blood pressure is all good. Now let's have a look at your skin, your hair and your nails. Now I know that you had some problems before with your hair, some hair fall that you were concerned about. Is that still a problem now? Oh, that's good to hear. And your skin and your nails, any problems there at all? Alright, so let's take a look at your hair first of all. Good. Okay. Hair density seems to be fine. Have you noticed your hair getting a little thinner? I see. It's not a problem. It happens to us all as we age. So you have some lovely grey hairs coming through. I don't mind grey hairs. I found a very big one on mine the other day and I was quite proud. I think it's very lovely to know that we are getting older and that we're still here, and the natural passing of time waits for no one. I'm quite looking forward to getting old, actually. What about you? I see. Alright, so your hair seems to be in good condition. And let me look at your face here. Let me just grab a torch. I wonder if this one's working. That's great. I'm going to just inspect to see these little bits here. How often or how long do you spend in the sun? Yes, and do you wear sunscreen? Right, I think you should maybe start using a daily sunscreen. There are some really great choices out there. I understand that they can be quite greasy and heavy on the skin, but the one that I use is actually formulated to just blend in very seamlessly to the skin, so it just feels like your skin. I'll give you the name of it before you leave. It's very good and I wear it every single day. Alright. Okay, I'm concerned about this little freckle here. I don't remember that from last time. I think what I'm going to do is actually refer you to a dermatologist. There's a couple of little spots on your face that not a cause for concern, but I think we should get them checked out. So I'm going to make you an appointment at dermatology, and they will do a complete full body examination just to make sure that there are no underlying issues with certain areas of your skin. Many people these days, they have moles or dark spots and they think, oh, it's nothing, but skin cancer and skin problems are very, very common, and if you don't catch them early, then they can develop into something that takes a lot longer to cure. And I mean, skin cancer is very, very treatable now, so it's good to check these things out early. So that's your skin. Can I just quickly take a look at your hands? You've started to bite your nails. Now, why is that? Oh, I see. Well, they do look a little bit red, a little bit sore, so I would highly encourage you to try to stop if you can. There's a couple of different nail varnishes and dips that you can buy that can discourage you from actually chewing, because it tastes blooming awful. So I'd encourage you to maybe look into that. But overall your hands seem to be in good shape. What about arthritis in your hands? Any aches or anything? Well, that's good. Anywhere else in your body, aches and pains? Very funny. Okay. Right, let's get you up and walking across the room to have a look at your gait. Okay? So just from that side to that side and back again will be absolutely fine. Good, and back again. Okay, and yes, come sit down, that's good. I noticed you were sort of favouring this side. Oh, what did you do to your hip? Oh, I see. So nothing that's sort of been troubling you for more than a day or so. Yes, okay, that's fine. Right, now to look at your eyes. So whilst we've got the lights on, I'm just going to shine this light into your eyes. Just look straight at me. Very good. Very good. Very good. And if you could just follow the light. Good. Alright. Okay, let's turn this light off. And if we could just do the same again. Good. Good. Well done. Good. Now follow the light. Very good. Excellent. Now I'm going to make it a little darker in here and we're going to do that test again. Alright. Good. Excellent. Very good. Yep. Now follow the light. Wonderful. Wonderful. Right. Now, whilst the lights are off, I'm going to come a little bit closer and have a quick look at this eye here. I'm going to swap instruments actually. And let's take a look in your eyes. Alright, let's take a closer look here. Now, when was the last time you made an appointment with your opticians? I see. Are you still wearing your glasses? I see. Alright. Very good. What about night driving? How are you with night driving? And the light dance flares? Okay. That's good. Okay, look a bit closer. Very good. Okay. Good. Okay, that's really good. Perfect. Just pop these lights back on now. I'll just go pop the other lights on. Okay. So, from what I can see, your eyes appear to be in a good condition. So the last eye test. Could you just tell me how many fingers I am holding up? Yes. Mm-hmm. Yeah. Yeah. Uh-huh. Good. Yep. Alright. So same again, looking straight at me. Can you tell me if my finger is wiggling? Okay. Yes. Uh-huh. Very good. Very good. Perfect. Okay. So, ears now. How are you getting on after your ear cleaning? I see. Any improvements to your hearing? That's good. Oh, that's really good to hear. Okay. So let's take a little look inside the ears, just to see what's going on and if that ear cleaning is looking still very effective. So let's take a look in this ear now. So I see that there is a little bit of earwax coming back, but honestly not as much as what there was before, so that's really good. Your ear canals seem to be very, very healthy, a really nice colour. I'm really happy with that. And let's have a look at this ear here. Yep, that all looks pretty good. I think that ear cleaning has really worked wonders for you. Yep. Okay, perfect. Yes, from what I can see, that ear cleaning was incredibly effective and very long lasting as well, so I would recommend that if you're not experiencing any hearing problems or anything like that, I would probably encourage you to have your ears cleaned maybe every 2 or 3 years. It only depends on really after your annual physical exam what I can see, if I would recommend you to go and have another course of ear cleaning. But if you wanted to take your own initiative and have ear cleaning done regularly, then I don't see the harm in that. Oh, I see, you quite like the sensation of it. Well, that's fair enough. So let me look here. Is right, we need to do some tuning forks and whisper test. So let's start off with a nice 256. So I'm going to hold it up to your ear and you just tell me when you stop hearing it, okay? About there, okay. About there, lovely. Let's try the 1024. Right. About there, okay. Alright, would you like me to do that again? That's fine. Okay. Oops. Alright, so I would say this ear on that frequency is a lot stronger than this one. When was your last hearing test? A little while ago, so I would maybe book you in for another hearing test. Do you have those annually? You don't? Okay. I would recommend getting them annually. A lot of people, well, in my professional opinion, we have sight tests every 2 years, but we have hearing tests less than that, and sometimes people go through their whole lives without a hearing test, which I think is quite bad really, because our hearing is so important. I know eyesight is probably more important, but your hearing, I think it's something that we need to cherish and look after, wouldn't you agree? I see, right. So I'm just going to now do a very quick whisper test. So I'm going to be whispering in your ears a word, and you need to just repeat it back to me. Alright, perfect. Sneaker. Chocolate. Come a little bit closer now and speak a little bit quieter. Okay. Mask. Coconut. Pale blue. Fork. Tony. Yes. Topaz. Okay, that's perfect. That's fine. Right. So, let's have a look at your nose. Now, any soreness in your nose, any nosebleeds, any discomfort around the outside of the nose? I see. Okay. Did I remember that you had a little bit of a soreness in the inside of your nose last time? Right, well, let's have a look at that. So, if you can tilt your head back. Let's have a look up there. Okay. I see. Well, there doesn't seem to be anything that I can see. Everything looks to be normal and clear and healthy. So maybe that was just a little bit of pollen irritation. What sort of time frame did you have it? Right, so that could indicate maybe seasonal allergies, if you're feeling a little bit discomfort in there. Okay, well, maybe I'll book you an appointment to come back for an allergy test, because I don't see in your records you have hay fever or any seasonal allergies. So it'd be good to get that checked out. Allergies, and whilst you're there, I'll also do allergies for food and chemicals in like products such as shampoo and everyday household things. It's fascinating, yes. I did one myself, and the amount of things that I'm actually allergic to that I never even knew. But it doesn't stop me using them, if I'm honest. Like my favourite shampoo, there's a certain chemical in there I'm actually allergic to, but it does wonders for my hair, so go figure. Right, nose is all good. So now I'm going to have a look inside your mouth. If you could just say ah, get that torch again. Let's have a look in your mouth here. When was the last time you went to the dentist? Perfect. Your teeth look really nice and healthy. Just stick your tongue out and stick your tongue to the roof of your mouth. Very good. Perfect. Yes, you can close your mouth. Now just bite down really hard. How's that teeth grinding? You're still wearing your retainer. That's good. Okay, now puff out your cheeks. Okay. Now I'm going to put my hand under your jaw, and if you can try and force your jaw open. Okay, perfect. Big smile. Very good. And then suck in your cheeks. Very good, lovely. You can relax. Alright, so now just look at me straight. Facial symmetry there. Okay, and frown for me. Open up your eyes nice and wide. Okay, now if you shut your eyes, I'm just going to put some pressure on the eyelids, and now just try and open your eyes. Good. And now I'm going to force your eyes open and just try and close your eyes for me. Very good. Wonderful. Okay, I'm going to just check your thyroid here. Okay. Swallow for me. Then just tilt your neck up and swallow again. Alright, good. Okay, so thyroid is good. Alright, any pain in your stomach at this moment in time? I'm just going to be pressing on it. Okay. How's your bowel movements? All nice and regular? Yes. Any bloating, discomfort? Good. Okay, that's all fine. And now, if you can just take my hand and squeeze it as hard as you can and relax. Now I'm going to cup my hands over your fist and just try and release your fist. Very good, well done. Now rotate your wrists one way and then the other. And then I'm just going to put some pressure on the wrist there and there. Does that hurt at all? Alright, brilliant. Okay, so I think that's all done. Perfect bill of health as always. Now I'm going to send you away for routine blood test and also that dermatology test as well, and you'll get those appointments through in the post in the next couple of days. And let me just check your email address actually, because we can send them to you via email if that's any better. Okay, you've changed your email address. Okay, so it's .com. Okay, let's update that. So you want to be contacted by email instead of post. Okay, perfect. Okay, so you should get that appointment through via email in the next few days. If it doesn't come through for any reason, then please do give us a call. Like I said, our system is on the fritz a little bit, so sometimes the emails don't go through. So I would say if you haven't got it by this time tomorrow, then do give us a call, or you can send me an email. But I would call actually. Alright, so that's you all done. It's been lovely to see you again, and I look forward to seeing you next year. Alright, yes, take care.